Stroke, also known as brain attack, is a serious life-threatening medical condition. Stroke hits one person in every 4 seconds and takes away one life in every 4 minutes.
Stroke or brain attack is caused whenever there is a clot in a blood vessel which cuts off the blood supply to a part of the brain, or a blood vessel ruptures and there is a bleeding in the brain. So ischemic and hemorrhagic varieties of stroke. There are irreversible risk factors like age, certain gender and genetic factors, but a whole lot of preventable risk factors. So in which the number 1 risk factor is hypertension, number 2 hypertension, number 3 hypertension. I can't overemphasize how important control of blood pressure is. Besides hypertension, you have diabetes, you have dyslipidemia, you have heart disease, you have lifestyle disorders like excessive smoking and alcohol, obesity, dyslipidemia, and a whole host of newer and emerging risk factors which especially contribute to stroke in the young.
Major concern is that 30% of the total brain attack cases are now seen in the adults less than 40 years of age.
You will lose suddenly a function. That is, suddenly there is a loss of vision. Suddenly there is a hemiplegia, loss of function of one half of the body. Haath pair gir jata hai. Suddenly there is a loss of speech, there is a loss of language. Suddenly there is a huge headache and the patient falls unconscious. Sudden coma. So suddenly one important function is lost, and that is the hallmark of stroke.
It is important to recognize the signs of stroke early and treat it as a medical emergency.
We have what is called as a FAST campaign, which means face. Whenever there is a sudden asymmetry in face, you can make them smile and there is a facial deviation. You can do an arm test, tell them to raise the arm. If they are unable to keep the arm raised, what about S is speech? Tell them to speak. They are unable to speak properly, and T is time. So that's called a FAST campaign. Recognize a stroke, come to us in time. If there is a clot which is blocking the artery, we can unblock it by a lot of drugs which are available. The right treatment in right time will save the patient.
Immediate proper intervention may prove life-saving and can substantially improve the outcome. Kiran Bhardwaj, DD News.